Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the routes of infection in pyogenic liver abscess? In pyogenic liver abscess, we have different routes. First, we have biliary tract. Biliary tract is the most common route of infection to pyogenic liver abscess. It's simple. See, in the liver, we have three routes. Liver will get, let's have, first it has two bile ducts, right? First it has two right hepatic duct, left hepatic duct, which forms common hepatic duct, which combines with the bile duct from the gallbladder to form common bile duct, which will uh, open into the second part of the duodenum, obvious, right? So now the infection can form from the bile duct to the liver. So in such case, the common bile duct stones are the most common stones or infections which are going from the bile duct, which are going from the bile duct into the liver. So this common bile duct stones will result in cholangitis, and it is seen in Asia. Hilar cholangiocarcinoma, that is a carcinoma which is seen in the gallbladder, which is called as hilar cholangiocarcinoma, can result in pyogenic liver abscess in Western countries, and even common bile duct strictures. If there is a common bile duct strictures, here there are strictures, then that means this will lead to accumulation of secretions in the common bile duct, which can cause infection leading to pyogenic liver abscess. Then the second most common route of infection in pyogenic liver abscess is by the portal vein, because even to the liver, portal veins will also reach the liver. So the most common mode of infection in the pyogenic liver abscess can be portal vein also, and also hepatic artery is also a type of infection. So the third common type of spread is by the hepatic vein also. In the hepatic vein, hepatic artery, sorry, portal vein and hepatic artery. Now this hepatic artery, it is mainly through hematogenous spread from the infectious foci can be anywhere in the body, but through the hematogenous or through blood route, it can reach the liver. Usually, the when the pyogenic liver abscess occurs through hepatic artery, then it is either monomicrobial, which is where only one microbe is involved. Preferentially, it can be either staphylococcus or streptococcal involvement is seen. Then sometimes there is direct extension is also seen in the liver abscess. So if you see the direct extension, if there is a subdiaphragmatic abscess, the abscess below the diaphragm, if there is a subdiaphragmatic abscess, so from there it can spread into the liver, or if there is a suppurative cholangitis, there is a cholangitis infection of the bile duct. If it is suppurative infection of bile duct, from there it goes into the liver, or if there is an empyema in the chest, it can go to the liver, or if there is abscess in the kidney, okay, there is perinephris abscess around the kidney, it can go into the liver. Okay, so these are the direct extensions of pyogenic liver abscess. Then sometimes it can even cause penetrating or blunt trauma is also seen in pyogenic liver abscess, and cryptogenic route of infection can also be seen in the pyogenic. Cryptogenic is idiopathic type of infection is also seen in pyogenic liver abscess.
thank you and thank you for watching.